Hello and welcome to the Hardy Brain, the show that takes athletic, introverted entrepreneurs and leaders and transforms them into ironclad brain performers. I'm your host, Dr. David Hardy. And today on our show, we've got another amazing guest. She is a strategic leader, innovator in brain health, and the coordinator of the AI Mind Project, a project that is aimed to ease the burden of dementia by creating innovative AI healthcare driven technologies to predict Alzheimer's risk in patients. Welcome to the show, Ira Haraldsen. How are you doing today?
Thank you so much, and thank you so much for inviting me, especially. It's a pleasure being with you tonight.
Absolutely. And this is exciting because we get a peek into another world here, and that is kind of what's going on in Europe and kind of the tech side there. But globally, if we were to look at Alzheimer's and dementia, uh, the numbers are staggering. Right now, it's estimated that there's over 55 million people who are diagnosed, and that's projected to shoot up to close to 140 million by 2050. What are you kind of seeing with the numbers that probably scare you or scare us society wise?
I'm not so sure if all this is so scary as it is in one way expected. We are getting older.
Right.
We all, for all people born after 2000, they have to expect to turn into their 100 years of life expectancies. And of course, this aging comes with a price. So therefore, we have to be very intelligent, very innovative, how we can prolong our healthy brain situation as long as possible, because the overall rate of infections of other diseases will be more and more treatable, meaning we are not any longer so easily dying as a species. And that means we need to be very clever to solve all these challenges.
Right. Now, we've heard that several times, kind of that, oh, yes, the risks of dying from this bug or disease is a lot more survivable, or and those chances aren't there as much as they used to be. But the thing that seems to be getting us are chronic diseases and illnesses, things that we're doing to ourselves, whether it's diet, lifestyle, pollution, all of the above, like a combination of factors. And I've even heard that life expectancy is starting to decrease and decline a little bit. So, where does this fit in with this longevity model that will make it to 100 years when society is kind of falling back? And one of those is, of course, lifestyle diseases lead to cognitive decline and impairment.
Yeah, of course, you are right. It might be very textual dependency, how the environmental factors add on biological genetic information, and how all this uh, will meet probably different societies in a different way. So, in that sense, you are right. Not everywhere everyone is getting older, but cognitive decline is something which is relatively recently really in an evolutionary dimension observed as we became older after the industrial revolution. So it is something new, you may say so, in science. That is one aspect. The other aspect is that the brain and the brain diseases have been stigmatized for a long, long time, and maybe they are still stigmatized and have received less attention. First now, when it comes like a shock, what is happening and how many people are affected by dementia, and that almost every family in the Western world has an experience of having someone or related to someone who suffers from dementia, since
Right.
it is coming into the public eye. But that is just recently, that is one issue. And of course, the real pharmaceutical success haven't been shown. Although we,
Yes.
yeah, although we have now hope with the new medications and with the new innovations in the pipeline from the pharmaceutical industry, it's still mainly a disease which is not treatable.
Right. And I look to a stat that's also been thrown out, I think, by the European Brain Commission, Brain Health Commission. And that stat is that right now, the burden of brain disorders, which is a far stretching, all encompassing diagnosis of things going on with the brain, is at $5 trillion. And to put that into perspective for people, there's only two countries in the world who have a GDP over $5 trillion. And I look at that number and I'm like, whoa, that is massive. And two, there's no treatment in that. It's just management and taking care of people. And I also look at a lot of kind of the pharmaceuticals out there. And a lot of the side effects are ones that impact the brain, that a lot of drug discovery has always kind of, especially in the pain world, is about dulling the function or perception of the brain. So, how does this kind of play into this model then? Like, what is changing or what needs to change there?
Yes, you're again so right. We will not be financially able to cover this problem if we are not creative and we do not have scientific insights. When this is said, then it will, first of all, it's very important to understand that dementia or is not one disease.
Right, it's not.
What we call Alzheimer dementia is as well not one disease. So, correctly speaking, it is a syndrome. And the syndrome might be caused by many, many etiological reasons. And we have to understand the interaction between environmental factors, genetic or proteomics together. How and why is someone turning from normal aging into pathological aging? And that
Uh,
we can only achieve if we are internationally working together. We have to solve it, as you said, in a relatively short time period because
Absolutely.
it will make us bankrupt.
And that's just the economic side. Like the other side to it is the years lost and the connections people have. Um, my grandma, she passed away from Alzheimer's a long time ago now, but I remember as a kid just watching and thinking just how cruel this is. That right there in front, it's no longer the same person, and being told that by family members as well. And it it's a I think about it now, and it's one of those diseases out there that it just robs you of all your life's experience, everything that you've accomplished, that you've experienced throughout a lifetime.
Yes,
And
I
what have
totally.
you seen kind of working in this realm too, that it's it needs more resources and in the right direction to actually get results, because this is a horrible way to go.
Yeah, I totally agree. So, therefore, what we are doing is, first of all, we are pushing towards a disease diagnosis or a syndrome diagnosis, towards a risk estimation.
Ah,
Yeah, that is very important because if you push the window of possibilities of intervention into a more healthy state of mind, you are potentially able to prevent or at least to prolong a little cognitive functional decline, which would not still affect your daily functioning.
right.
Of what you discovered with your grandma and what we all together experience being together with people affected by Alzheimer's disease or other dementias is this kind of depersonalization. They are losing their personality. They are, as you said, not any longer the human being they had been. In a sense, they are emptying themselves. And that is a horrible, horrible experience for themselves, pretty sure, and as well for us, relatives, friends, society. So, pushing towards risk estimation is essential because it is under-communicated that 45% of all dementias could have been prevented in a multifactorial sense if you would have known the risk. But because we have no tool at the moment to identifying the risk, we are struggling. So that is
Uh,
AI Mind. AI Mind is working with risk estimation.
so, with that being said, what are some of the risks that need to be addressed here? And then later, what about behavioral changes, though? That it's a hard thing to get somebody to change their lifestyle. But
Yes,
what are these sort of risk factors, and then at what point in time, too, in the disease process, should risks be actually analyzed and be made available to people?
right. I think it is a very complex question you are asking because I could provocatively say you have to start after birth
Exactly.
if you take it very far. But that is, of course, completely unrealistic. Um, but in a sense, the 14 identified factors Lancet published in last year are all known from also from other medical diseases. It's blood pressure, it's about hearing loss, it is about social isolation, it's obesity, it is depression, and so on.
Right.
Of the factors is really hopeless. Yeah, you could manipulate or intervene in each of them, but each factor to be intervened on is complicated because a depressive human being has to understand, or you as a doctor have to understand the interaction with other factors of biology in this patient. Not every depressed patient will develop dementia.
Right,
It,
exactly.
it needs other factors. And then you're talking about the next step because AI Mind was first about the prediction in a still already slightly functionally affected state of mind, but without structural deficits. Okay? Uh, Now, when we are there, we have also to understand other organs' impact or gene impact on this risk. And therefore, we are now looking into these people identified at risk, because in the state of mild cognitive impairment, mainly called MCI, in these people, 50% will not decline,
Right.
50% decline. So it must be of huge interest also to study those who are not declining. Because which factors, which kind of resilience has this brain not going into dementia direction?
Hmm. And what have you
And
seen out there in that regards then? What is it that could be that trigger or flipping point for people?
right. Therefore, we need to merge AI technologies with simulation technology. We need to merge now this algorithm world. And usually, these scientists, those who are simulating and those who are predicting, in a sense, in AI, are not very close to each
Right.
other. Yeah. So we need to make it a fruitful interdisciplinary communication issue that dementia is getting more attention in the interdisciplinary field of research. Because what you now have to do and what we are trying to build now in new consortium is, okay, giving the individual heart of the AR Mind participants, given their individual kidney situation, given their individual um, environmental conditions at home. How much are they really eating, not eating? What are they eating? How well are they sleeping? How disturbed
Right.
is their sleep cycle, and so on? All this kind of information needs to be brought together, and then in a virtual lab setting, identified for more correct stratification.
So
And
if I'm
hmm,
hearing this correctly, research, the old model is kind of going out of the window, where
yes.
it was a factor of one, n of one, that you're trying to just eliminate all these different factors down to one, your random
Yes.
controlled trials. And now with technology, with machine learning, AI, we have the ability then to combine multiple factors so that we're actually in a holistic model that we've been craving for so long. Is this the right
Yes,
direction?
this
Yeah.
is, that is just the right way.
Amazing.
And that is where the industry and the academia world have to merge even closer than before. Because we can't achieve that only by academic research. We do not have necessarily all researchers. What we're doing is now with such global leaders like Bosch, sensor technology, and Philips on the, for example, on the visualization part, we now try to reach really also home-based information to
Right.
transfer this in a secure GDPR way into the virtual lab scenario, and then merging with more classic hospital or doctor uh, office like interventions together, these data. And these data are, of course, complicated because everybody is talking about it, but often data are coming from different hardware, very much noisy, and so on and so on. And human flaws are going into data collection. So, what we really see in medicine now is a shift revolutionizing medicine towards a more manufactural engineering And there we need these procedures standardized in a very unknown way. It's not any longer about large language models, which are pretty much in the favorite wind now, but
Right. Yes.
it's more about um, perceptional, instrumental, gathered values, putting them meaningfully together without eliminating. Of course, all methodologies have always uncertainties and limitations.
Right.
And you
So,
need to
two on
understand.
this point, you mentioned sensors. And
Yes,
sensors are basically how the brain and nervous system run. We've got sensors that read so many different things. And traditionally, healthcare has been stuck in this chemical model. It's
yes,
drugs, it's nutrition, even they fight.
yeah,
So good luck to academia to figure that one out. But the brain is about sensory stimulation. So, what role does neuro rehab play in this? And then on top of this,
mm,
traditionally, healthcare loves to make things very, very expensive. And you can't strap an fMRI on somebody and tell them to go do some balance exercises or coordination or hand eye movements. So, what on earth is the answer here?
yes. Uh, you put it so wonderfully together. It's right. It is. Will and has to be both. Of course, sometimes we need very advanced high tech, but because of this wonderful AI renaissance, I will call
Right,
it, or the supercomputing hardware improvements, we are now able to go back to technologies which already gave us potentially tremendous insights, but where the human eyes had not been able to analyze it good enough, like our old fashioned EEG we are using in AI Mind.
yes,
AI Mind will couple EEG information with proteomics and genomics and more classic cognitive function. But we are already now analyzing our data and experience the hope that maybe we are good enough with EEG and blood biomarkers because um, the EEG is in fact opening the synaptic world to be measured. And the synaptic world, it's more or less electricity.
right,
It's always the start of a disease. It can't become a, a proteomic or a structural problem if not in the beginning an electric problem would have been the trigger. So therefore, we let the machine analyze brain brain electricity differently or on own terms by deep learning. And
right.
we are already there that we discovered, we have not yet published it, but it will come very soon, that there are features which we think discriminate the so called at risk and non risk, and that these electric features very much are correlated to what is going on then on a proteomic level. And
I love that. And just for the viewers, if you're not sure on that, basically kind of the level that communication happens in the body is that, yeah, you've got communication systems, electrical, chemical, and then that produces a result. And
yes,
that result is going to be the different proteins that are made. And there is this communication system, though, between that book we've all been born with, our DNA, and then what's actually going on in our system that produces that output or end result. And you're measuring all three of these, correct?
Yes, this is correct.
And the combination and how they interact.
Yes.
Wow. Now, what's the limitation here, though? Because, like, EEG or QEEG, reading the brain waves, uh, classically, it's only the cortex. So we're still missing half the brain. We're missing the brain stem. We're missing the cerebellum, all these areas that communicate to, like, everything that's foundational for life. If we didn't have those parts of the brain, we would die. If we don't have our cortex, we just become impaired.
Yes. Again, you are very right. This is, of course, a huge limitations. But EEG, if you are not evaluating an EEG as a two-dimensional face value thing, which is giving you, for example, like an ECG information about spike in waves when you get an epileptic seizure,
Mm-hmm.
or you are on intensive care and have experienced, unfortunately, a major um, stroke or something like this, then the EEG is usually not possible to be analyzed correctly by a human being in a decent time frame. A human being
Uh,
could do so, but it's too much information during 15 minutes or 1 hour or 10 hours, which is impossible for you in all frequency to be analyzed sufficiently. So, what the machine is doing, it is taking this mathematical idea up of a brain network. How are the different areas communicating? And you can also, due to mathematical understanding, calculate a little bit further down in the brain. As you said, not only on the,
yes.
you can
Yeah.
also calculate a little bit from other areas of science, uh, how the thalamus cortical connections would work. Yeah. So what we are doing, we give some ideas into the machinery, you may say so, and then we let it analytically find its own way to identify features which could be relevant for disturbed brain connectivity. And
So
that
absolutely fascinating. What's your prediction on this for the future, though? Like,
for
where
the,
do you see this evolving and affecting people's lives? And how do you see AI mind being a part of this?
my future vision would be, in fact, that such a cheap technology
Mm-hmm.
could be installed in a regular investigation, like you go to your cancer prevention. You would go above the age of 50 to your brain connectivity uh, analytic,
Right.
yeah, and then independency of your age and maybe other risk factors, the doctor would add on then order a little bit different biomarkers, and then the doctor would send this information to a platform which is called AirMind or whatever it would then be called. And then it would give you a risk estimation for developing dementia of Alzheimer type, dementia of Parkinson type, or you name it. Because you are then only mixing these factors in dependency to, again, to probabilities in this specific patient. And when this is done, then you would add on, as I earlier described it with the sensor technologies from home, and then you would give out at the end as a doctor an expert recommendation what you specifically should do to reduce the one or the other risk. And that all this will be possible in relatively short time, as the machine is working on it, not you as a doctor or you as a patient. And then the effects would be how you could improve your functionality towards the one or the other disease.
Right. And we're not talking just a disease process here. This also would have potential then for improvement. And of course, improvement, though, one of the biggest things in improvement is don't get less healthy. So this is this is a great tool to kind of point us in the right direction. And there's been a lot of investment into this too. Kind of where is AI Mind at in terms of kind of a company and taking a lead role in this field? Then,
Yeah, we are now at a stage. First, the European Horizon program financed us. Then we added on two other major Horizon programs, so that we had almost a 45 million portfolio to make this possible. But
wow,
then we need now, of course, to commercialize it,
yes,
to make it a product which is then taking up from maybe first smaller SME and later maybe major industry to be distributed. This is important, and that is always the difficult part. The threat is not necessarily in the idea and doing it and showing it that it works. It's the threat is always in implementing and changing the traditional way of viewing how you should meet your patient. So
right,
there are obstacles, but we are working hard on it, and we are collaborating with major pharmaceutical industry like Roche Pharma and Roche Diagnostics. We are now expanding that as well to, as I mentioned, to Bosch, to Philips. So there will be actors. It will take time, but as you said in the beginning, as it is such a global threat, it needs to be very speedy now implemented. There is no doubt, and we have already also the first customers. Some of our Northern European health regions ask us already if they could get access and buy services from this platform. But
mm,
there we have a little
yeah,
bit different situation between the US and Europe. In Europe, algorithms now are considered being medical devices. So what we are
sorry,
now,
what's considered a medical device?
an algorithm. If
Algorithm, yes.
if the algorithm has intended reasoning towards a patient, yeah. So therefore, we are pushing now our algorithms into this pipeline of approval, so that we first go to the EMA and FDA and that we are in fact approved. And when we are approved and also the platform needs approval, then we can launch it. And I guess we will need maybe 2 years from
Okay,
now. But
so
then,
it's the near future.
yes, it
Wow,
is the
it's
near future.
coming.
It's coming.
That's got to feel good because I know you've put in a lot of hard work in this and you're coordinating all this. So, how do people find out more information about yourself, about what you're working on, and how do they reach or contact you if they need more information from you?
Yes, of course. You can either go to www.airmind.eu. Or you contact me by LinkedIn.
LinkedIn,
Uh,
yes.
my name, Ira Haraldsen, and always are fine. So you will always receive an answer, and we are all happy. All partners are happy always to come in contact with most of all your folks, so that we can beat this battle together.
Intriguing. And once again, thank you for sharing your knowledge, your passion behind what's reshaping economies and society. And that is health, that is integrating new technologies, new innovation. And you're one of the leaders out there. So thank you for sharing this with us. And for everyone listening, stay tuned to the next episode of The Hardy Brain, the show that takes athletic, introverted entrepreneurs and leaders and transforms them into ironclad brain performers. Take care.